Hi, I'm Dr. Milescu, and I'm here to discuss the ear. This is our last lab in AMP1. I'm a college professor at Daytona State College-Deland Campus, and without further ado, let's get started on the ear. So, the last topic in AMP1 is the ear. So this big ear model right here. So this is called the auricle. And then as you go through here, when you put your Q-tip in your ear, that's called the external acoustic meatus. Hopefully you don't go too far and hit the tympanic membrane. Let me show you the tympanic membrane on this model. You can see much better right here. There it is, tympanic membrane. Okay, and I'm going to put this aside. So I like using this larger piece here. So the outer ear consists of the auricle, external acoustic meatus, up to that tympanic membrane. Then the middle ear, you have everything here up to the oval window, which is right here entering the inner ear. So this section right here, separating it, okay, let me bring this closer. This whole section between my two hands, that's the middle ear. So the middle ear consists of three little ossicles right here, 1, 2, and 3. I don't know if you can see it. They're pretty visible. 1, 2, and 3. And the mnemonic I use is MISS. MISS stands for the first ossicle that you see here anteriorly. And that would be, and you have it on your handout, the malleus, the incus, and the stapes. So make sure everything on your handout that is listed you identify on this ear. So here we go, one more time. Malleus, incus, stapes. And the stapes, just think of a stirrup, because it does look like a stirrup if you ever do horseback riding. And then the stirrup, right adjacent to that, is that oval window. There's also another window called the round window. But on this model, you probably can see definitely the oval window. And then if you look here, we're going to take a look at the inner ear. So the inner ear consists of this structure that looks like a snail right here. Doesn't it look like a snail? So that there is the cochlea, responsible for hearing. And then this that looks like a roller coaster, that's the semicircular canal. So the semicircular canal is responsible for equilibrium and balance. And the cochlea with the perilymph is going to create some changes that creates an action potential to that cranial nerve number 8, which is the vestibulocochlear. Now be mindful that the vestibulocochlear is one very large nerve, as you can see here. All right, so axons that go to the semicircular canals, those are called the vestibular branch. And then of course you've got the cochlear branch coming from the cochlea. So cochlear branch, vestibular branch, and then there's a nice nerve that's much thinner. You see right there, that structure right there on top. That's the facial nerve. It's going to come out this way and innervate the face. So facial nerve. All right, so the only nerves that you have to know on this model is the vestibulocochlear. Vestibular portion goes to the semicircular canal. Cochlear portion is arising and coming from that cochlea. Okay, so if you ever know somebody that is hard of hearing, they have a cochlear implant. So the implant emulates what this structure is organically in our body. Okay, we have endolymph inside and we have perilymph, and so the fluid in there changes and stimulates the stereocilia, which then causes an action potential down the vestibulocochlear nerve to do its thing. So if it goes to the cochlear nerve, then the brain will process what that hearing is, if there's a memory of what that particular sound is, and identify the sound. So this is how you identify sound, basically. So pretty fascinating. So that's the inner ear. And the last thing I want to mention is the pharyngeotympanic membrane, also known as eustachian tube, also known as auditory tube. And so that's pretty much it. So there's 10 structures you have to know. Let me number them, so maybe that helps you. 10 structures. So the auricle is number 1. Number 2, MISS, remember? Miss Malleus, Incus, Stapes. You got the semicircular canal. You got the cochlea. You got the vestibular cochlear nerve, the facial nerve, and you've got the auditory canal, also known as pharyngeotympanic canal. And don't forget, there's the oval window right here where the stapes meets up with the semicircular canal. There's this oval window is connective. It's a membrane of connective tissue. Let me go over the list to make sure everything was mentioned. You know all about the earwax that's coming out of the external acoustic meatus, tympanic membrane. I showed you what that looks like right here, tympanic membrane. That's when you burst your eardrum if the, injury. Hopefully that never happens in your lifetime. And what else is on the list? That's pretty much it. You got the semicircular canals, which I mentioned, the cochlea. The inside of the ear we'll go over when we do the PowerPoint, because that's not on, you can't see it on this model. All right, looks like that's it. I am done for the semester. I don't know what I'll do with myself. I guess I'll have to do some fitness videos. All right, have a happy Thanksgiving, Merry Christmas, Happy Holidays, all that. All right, ciao.